It's 11:11. Make a wish.
It's Shelli, and if you're looking for the rest of the interview with Megan, I fooled you. This is not that. This is something different. Last Saturday was the conclusion of Armed Forces Week here in the United States, and you'll see why I mention that in a minute, but also today, specifically here where I live, the Blue Angels did their annual, I don't want to call it a flyover because it's their show. Anyway, so I thought it would be fitting to release this particular episode, and I just got really cold. I'm not going to be re-recording this because it's been a disaster, and this is what 9 o'clock on episode release day looks like. When your brain is like mine and you're a little disheveled, and tomorrow is your youngest child's last day of high school, and blah, 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 all the feels. I'm going to be having hip surgery. I don't know when, so I'm also trying to kind of save content a little bit in case we have issues. And we're going to be at the conference in July, and June is really soon, so I guess I don't really know what I'm trying to say anymore. Remember what I said about release day? It's a little bit dicey over here. So between graduations and injury and life and travel, we'll see what happens. But after May, we are going to be going back to our bi-weekly release schedule that we've been doing. And without further ado, here's what you get tonight.
All right. Hey, welcome to the Hacking Hypermobility Podcast.
So this season, we are uplifting more marginalized voices intentionally in our community. And ironically, men are underrepresented versus women. So today, we've actually gathered some dudes from the zebra herd.
Right. But before we introduce our guest, Luna, what medical research and background information do you have on hypermobility and those assigned male at birth?
So there actually isn't much in the medical literature about hypermobility specific to men. But I'll go over some highlights because there is a little bit. But first, our disclaimer to listeners: the information provided in this podcast episode is for educational purposes only, should not be considered medical advice. We are not doctors. Our guests aren't doctors. So consult with your own healthcare professionals for personalized guidance on managing Ehlers-Danlos syndromes or connective tissue disorders. So in medicine, hypermobility is commonly associated with another inherited connective tissue disorder we've mentioned a couple times called Marfan syndrome. We've talked at length about hEDS or hypermobile EDS, which is the most common subtype of EDS. hEDS representation is typically female. It's statistically more common for patients diagnosed with hypermobile Ehlers-Danlos syndromes or hEDS or joint hypermobility syndrome or JHS to be assigned female at birth rather than male. While we share many similarities in our disease states and experiences in the medical system have been different just from conversing with each other. So from within my own family, I would even suggest that our presentation, male versus female, or symptoms and progression are a little different also. But that's anecdotal, so let's look at the medical literature. This is the first one. It's about the prevalence. So a very large statistical analysis was done in the UK. So it's UK patients. And they pulled a data set from 1990 to 2017.
Okay, that's a long time.
Yeah, so it's thousands of patients. And it showed two disparities. Fewer men are diagnosed with hED, in hypermobility, yet women are diagnosed with a longer delay for older. So 70% of individuals with EDS or JHS in this UK data set were female. 30% were male. So 7 to 3. The study also found that women with these conditions were generally diagnosed almost 9 years later than men. So men are diagnosed at a peak age of between 5 to 9 years old, and women 15 to 19 years old.
Times 2 plus a few years.
Right. Most of us are much later than that. There has not been much research on the differences on gender at birth. And while sex hormones seem to play a role in the expression or the severity of our symptoms, hormone modulation in relation to connective tissues is not yet fully understood, but it is noted in literature. There is a little bit of comparative literature about gender differences in hypermobility, but there's not a lot. So first, there's an article published in 2016 in the VMC Sports Science, Medicine, and Rehabilitation journal titled Muscle Strength Differences in Healthy Young Adults with and Without Generalized Joint Hypermobility, a cross-sectional study by Jewell et al. And so this study is honestly mostly about strength differences between hypermobile and non-hypermobile humans. And here's what they found. So the findings indicate that male participants with generalized joint hypermobility have less isometric muscle strength in both elbow extensors and right knee extensors compared to non-hypermobile male participants.
So that's like
Yeah.
curls.
So female hypermobile participants did not show any significant differences in muscle strength compared to non-female hypermobile participants. And approximately 3.3% of women and 0.6% of men with generalized joint hypermobility tend to develop pain in their lower limbs and shoulder joints. So there were some differences in the joints, the strength differences, as well as pain. And this was, obviously a limited study. And there's another article from the Journal of Canadian Chiropractic Medicine in 2020 titled Clinical Management of, quote, benign joint hypermobility, a case series by Boudreau et al. And it focused on male hypermobility, but mostly in relation to athletic performance. I will say it is titled benign JHS, but that is an outdated term to listeners. So they noted that hypermobile male athletes, based on a Beighton score of between 4 to 6 out of 9, had a 66% lesser chance of injury than their male colleagues. However, there was no difference in the overall injury rates observed in the NCAA lacrosse players. Though hypermobile athletes did show an increased risk of ankle injuries, more recent reports have increased injury rates in hypermobile rugby players, netball players, and soccer players.
That's contact.
Thus, the consensus is building about risk from hypermobility in the athletic population. And there are a few case studies of hypermobile men with injuries, and they're all athletes. And some have been in the news actually about being taken off of NCAA teams or not making a team because of the diagnosis. But it's interesting, a lot of these studies are in relation to sports medicine and athletics. There is an article from Castori et al. From Italy from research published back in 2015 in the American Journal of Medical Genetics that says they identified a few differences between the sexes and thus indicated an attenuated sexual dimorphism of just the mucocutaneous features in JHS and EDS. So skin.
Yeah.
So again, just a very narrow finding, and that was a very small sample size. There are several published case studies about individual cases of men getting diagnosed with Ehlers-Danlos syndromes or particular complications, reviewing like individual presentations. So, for example, one of the studies I found was a 2018 case, which is a particular experience a male would have that a female zebra wouldn't have. titled Testicular Torsion in a Patient with EDS. So it really shows there really is lacking information in medical literature specific to the male experience.
Right. And so it's not unusual to see healthcare disparities in this light. And while it's important that we don't minimize how healthcare disparities have affect hypermobile humans assigned female at birth and other marginalized populations, we think it's really important to have a conversation about how hypermobile men have been marginalized in this particular experience. And that intersection is really important. So
that's why we
Yep.
have invited y'all today.
that's why y'all are here.
As you can see, these disparities and the gap in research may lead to a couple of things. I'm going to make some assumptions, and I think we'll learn more as we talk with you all. One, I think there's a lack of awareness that this affects men. Two, I think there's a lack of representation.
Yep.
Three, there's obviously misunderstandings about your experience and your health needs. And four, there seems to be barriers to diagnosis and care. So moreover, though, this creates a particular, I'm assuming, emotional dynamic with health for hypermobile men that could create some struggles. But this really isn't our story to tell.
Right.
So let's welcome our special guests to this episode. We actually have a panel today we've gathered.
Yes. So without further delay, we are going to introduce our men's panel. So here are our bendy dudes. We've got Brandon.
Hi.
We have Bryan.
Hello.
And Doug. Okay, so let's take turns getting a quick background from each of you, and then we will have some turns asking questions after each panelist has finished their thoughts. So,
yeah,
question, answer. All right.
So I guess we'll go in alphabetical order again. Brandon, can you give us just your quick bio, who you are, something interesting about you, when you got diagnosed, that sort of thing?
So, okay, my name is Brandon. I'm 32 years old, and I was officially diagnosed about a month ago.
Welcome.
So, it took a lot of effort. It was a lot of different doctors and a lot of different ways to be gaslit, and that's so fun. But I'm a little bit new to the community, so I'm not going to interject too much of my opinions. I'm here to listen and give responses to what I'm asked. But I would say I'm not quite an authority yet.
You're an authority on your own body, though. So
What she said.
I wish
Absolutely.
I was.
Yeah, and you'll find that you've been experiencing things that people have been describing wrong your entire life, and you'll start going, wait, hold on, are they talking about this thing that actually I do? You'll find very quickly that you're actually.
I didn't know that I subluxed joints all the time. I was like, oh, is that what's happening?
That's just
Sorry, I jumped in before.
Anyway, so
thank you, Brandon. So
Bryan?
how about you, Bryan?
Okay, since I just barged in there, my name's Bryan, and I got diagnosed 2 years ago, and I've shared a lot of my experience with Ehlers-Danlos Syndrome since then on TikTok. When I got diagnosed, like Brandon's finding out, there was not really any male representation, and especially at that time on TikTok, there was a lot of female representation. And I just joined the conversation. It wasn't to represent men or anything, or please. I was just, I was excited to be able to add my voice. And since then, I've had 6 surgeries to correct damage just from having the Ehlers-Danlos syndrome. And for my background, I grew up in a military family and was very athletic in combatives from an early age. I remember going over to friends' houses and boxing at sleepovers. And then, I was wrestling in middle school, and karate and jiu-jitsu, and did Muay Thai. And then I joined the Marine Corps. and I was in the Marine Corps for 9 years, and it's a very active life. And I was constantly going to medical, but you know, they aren't going to see what they aren't looking for, and I was in a lot of pain, and I decided to leave before I could retire. So I left at 9 years, and fortunately, I'd set myself up pretty well, and I became an engineer. And then I got sick, and now it's paying off because I have good insurance to get all these surgeries. All right, that's me, man.
Thank you. Thank you, Kinda Spinny. And Doug, what about you?
First, I'd like to say that, Bryan, what kind of engineer are you now?
I'm a commissioning engineer.
Commissioning.
And, yeah, I work for Bechtel. Are you familiar with Bechtel? Yeah. So I worked on the nuclear waste treatment plant as a mechanical test engineer, became the lead test engineer, and then went to Amazon and worked in the data centers as a electrical test engineer.
Very nice. I'm a mechanical engineer, and I've worked in data centers for 20 years. And
Nice.
I love the environment. But yeah, it's something new every day. You can climb around the building. You can go on the roof. You can get out and around. You're not chained to a desk, and that suits my body very nicely. But,
yeah, I was already sick by the time I went to Amazon, and so I was just running on fumes by the time I joined them. But I really loved doing big industrial startup. I mean, I did chilled water startup for 10,000 gallon system, 3,000 gallon per minute pumps. Like cool big stuff. That was fun to me. But now I just remember it fondly.
The girls are loving this. We're
laughing.
Yeah.
And I can't count how many engineers are in my family, so it's just
Yes. So I'm 48. I was diagnosed 2 years ago in 2021.
Okay.
At 45, which seems to fit everything. Yeah.
That's-
Yeah, Shelli too. Yeah.
middle age.
Yeah, I was 44, but only a few months shy of 45. So.
Yeah. We actually, I'm father to 2 girls. One, it's her 19th birthday today, the younger one, and the older one is
happy birthday.
The older one is 21 and a half. So they're a year and a half apart. The older one is diagnosed, hEDS diagnosed also. We actually got her diagnosed before me because it was easier to get an appointment for a pediatric. And I was diagnosed 3 months after her. So she was diagnosed in August of 21, and I was diagnosed in November.
Of 21? That's the November 21 is when I got my diagnosis.
So
Twinsies.
and also they went through like a family diagnosis like we did. Also interesting.
Sort of, yeah. We got an appointment with my daughter first after. Well, I figured out for myself what was going on with me, and then we all sat around the kitchen table and did hand tricks. And of course, my older daughter said, "Oh, I can do all that stuff too." And we were able to get referrals for her and get her an appointment relatively quickly. And at her diagnosis appointment, the physician squared me up and down and said, "You need to go get diagnosed too, but I can't do it because this is a children's hospital and you're too old. Our age limit is 25 and 1 day."
That's interesting. So they sent me to a pediatric hospital for it. Yeah. So
I went to my my son's primary care doctor just because he was the only doctor that I had enough rapport and trust to bring it up to.
Yeah.
So are you all hypermobile Ehlers-Danlos patients, HEDS patients?
Yes.
Is that your official diagnosis?
Mm-hmm.
And so how were you diagnosed with that? So you're the newest one, Brandon. How were you diagnosed with that condition?
I actually saw a pain specialist because I had given up trying to find a diagnosis. And during the appointment, he just goes down the list of, so what's your problem? And I tell him all my issues. He's like, that's EDS. Have you heard of it? And my jaw drops because would anyone else expect a doctor to bring it up unprompted? I was floored. So eventually he started like breaking down all my different symptoms, and eventually he's like, okay, yeah, you have EDS, and oh, that issue, yeah, that's mast cell, and maybe that's something just completely a gag. I'm still reeling. It's a core memory.
Yes, core memory.
I still remember
Exactly.
you messaged me when that happened, and you didn't believe it.
That was in the parking lot. I was shocked. I didn't know what to feel. I was like, do I cry? This has been a problem for years. Ooh, oh.
Yeah. So
in all fairness, I went into my diagnosis appointment knowing that I met all the criteria 100%, and I had known that for almost a year, and it still felt like I got hit in the face with a 2x4 when I was walking out to the car.
Yeah.
Just to have the official recognition.
Yeah, like,
well, and then I don't know if you guys have experienced this, but you know, when I did the same thing, Doug, you know, had the criteria, pretty sure, you know, I was already making TikToks about how I, you know, met it, and approached, you know, my son's doctor, and he was a physician's assistant. He was former Navy corpsman who, when he got out, he went to school, got a degree, or maybe he did it while he was in. I don't know, whatever. But he also, at the same time, he said, yes, you meet all the criteria, but he, like, the big key, and this is what I tell people whenever they ask for, you know, tips about diagnosis or that process, is he listened to me, and I was able to say, okay, I need to see a neurologist because I have these issues. And then I knew what neurologist to go to, and he facilitated the referrals and coordinated the primary care from there. So, you know, I try to give people some hope that you don't have to see an EDS doctor to get diagnosed with EDS. Your family doctor can diagnose you. And most importantly is just starting the ball rolling on the specialist care, because you need to have you had your heart checked out yet?
Mm-hmm.
Mm-hmm.
I pulled myself back from giving Brandon advice about who his next doctor should be.
Yeah.
Well,
And then we talked to Tiffany.
Yeah.
fair.
Thanks, Tiffany. Thanks
So,
for jumping in.
I mean, that brings up, like,
Right out of the shadows.
what next doctor thing is important, because Brandon mentioned his pain doctor talking about MCAS. So my next question was like, well, what other comorbidities, other health issues related to EDS do you experience, and what are the, like, biggest impacts or struggles from that on your daily life with your health?
Should I start, or?
Yeah, go ahead.
So besides the EDS, I got vasovagal syncope that borders on POTS. The cardiologist didn't want to do a formal diagnosis because it's the same thing.
No.
So, okay. I mentioned the mast cell. At one point, I caught hemochromatosis randomly through a checkup. So I don't know if that's related or not, but it's there. And I'm speculating I might have erythromelalgia, which sucks.
So what are, like, the biggest symptoms, like, affecting your daily life? Like, what is it that's your, like, biggest health struggle, Bryn?
The big struggle is kind of everything. I live a very sedentary lifestyle, despite the fact that I'm trying to do drag as a drag queen, and it is difficult to do that because there are so many different things that can go wrong. My skin is squishy, so if I wear a wig cap, it'll cut off the circulation right here in my brain. I'll get a horrible headache. I've cut off circulation to 2 of my toes where they were numb for days. And that's just that one part. Just standing up too long, my body isn't strong enough to hold myself up. If I do too much walking, my feet will catch fire. Sometimes my legs will just be in random nerve pain just because they're in the mood. It's so fun. It's so great.
You have a very odd sense of fun, but I know you're being sarcastic, and I'm laughing because I know Shelli and I both have all of those symptoms.
Yeah.
Yeah.
I just changed out my glasses. I'm not wearing them now. They came in today, but I'm going back to my old frames, even though the new ones are like more trendy and on point with style, because I can't adjust them to where they won't give me a headache. They pinch here, they like no matter what I do. So I'm just going back to a regular solid frame with the piece. So I broke the pieces, popped off all the time. So, but I get that. It's hard to identify what the pain is because it's everywhere.
So
Yeah, and like growing up, I had all this pain growing up. My mother brought me to doctor after doctor after doctor. She's like, something's wrong with this kid. He's always complaining about pain. And the doctor's just like, She thought it was muscular dystrophy. It turns out she was right that there was something wrong.
Yeah.
so frustrating to hear those stories because I think a lot of us have a level of, trauma with being under support, undiagnosed. But a lot of us, our parents tried, or they're trying to treat symptoms, but the pieces of the big puzzle never got put together.
Right.
So I'm sorry you experienced that, but thank you for sharing that part of your story. So, Bryan, what about you? What is your biggest hang on condition?
Well, so I've been diagnosed with POTS, and I'm being evaluated for MCAS. I really don't have a whole lot of allergy presentations, and maybe that's just where I live. But
Be
even where,
surprised.
So
yeah, but
I'm going
even
to
where,
interrupt you before you say that. So Shelli and I are both thinking the same thing. We did this great interview yesterday where we learned that MCAS presents not just as allergy conditions.
Because I didn't know this. I was having some issues a couple of times yesterday. And as Megan was leaving, she's like, I want you to know that I observed MCAS type reactions in you multiple times today. Didn't say anything but so yeah. And she actually knows my POTS clinic doctor. And I was like, well, how do I get this beta blocker? How do I get this up? And she's like, message Erica, she'll hook you up. And then she texted me exactly like, I was like, oh, I could have been not feeling awful
cool.
for over because it was almost a year now that I've been the POTS
pattern
clinic.
I keep seeing in HEDS patients will be like, well, I don't have the MCAS as like that.
Right. Like I always thought it was anaphylaxis.
But we're experiencing it, and it seems to be very deeply connected to our pain. So if you start paying attention to your histamine responses and take some histamine blockers for a period of time and then eat a low histamine diet and see what changes when you stop all that. For me, it was a pain thing because I don't have a ton of, I sometimes get hives or weird reactions or whatever, but mine was mainly what I'm going to call the invisible symptoms of MCAS. The mast cells are doing other things. It's not just hives. So anyhow, I encourage you to investigate that further. Continue.
Blew my mind yesterday.
My son has a lot more allergy problems, and so his allergist is the one who is evaluating me. So like I don't know if have you guys talked, I'm sure you guys have talked about the MCAS process, but just without going into too much detail, I've provided a baseline sample for histamine levels, and I'm kind of like waiting for my next flare event, and then we'll see if it's MCAS or not. But in the meantime, I take a H1 and an H2 prescribed blocker, and I can definitely say that whenever I was first getting diagnosed, my body was shutting down. I don't know. Did I go through my story yet? I'm not sure. I think I've just been kind of bouncing around.
I don't know, because I think we got lost during the how you got diagnosed part. I don't remember.
Yeah,
So maybe if you did, we didn't hear it, but it was still recording the entire time, so none of that was lost.
Oh, was it?
Yeah,
Okay.
yeah. Once we
Okay,
start
great.
recording, anyone can drop out, and that's a fail that's a lesson we learned yesterday.
Okay.
Not in a great way. Anyway,
bummer.
that was a Shelli
Tangent.
snafu. Anyway, continue.
Okay, well, so I basically, I grew up with military medicine, in charge of my body. My parents were not accustomed to how do I want to say this? They were the kind of people that didn't believe in mental health. Like my dad will still say he doesn't believe in mental health. My adoptive father, I'm sorry, I was raised in an adoptive family, so there was some delays there. But yeah, pain was the number one symptom, always the number one symptom. And once I got out of the Marine Corps and I went to the VA, and the VA didn't have any answers and really treated me disrespectfully, and exactly like you guys are saying, being gaslit and blown off, and
Yep.
just really getting the impression that the VA is it's a difficult place to get care for EDS from, unless you have a defined diagnosis and kind of a really strong patient advocacy kind of bone in your body. It's going to be hard to get through the VA with the EDS. Is my experience. And so whenever I started going to, like I said, my son's pediatrician, I trusted him, and he started sending me to the specialists. And at that point, I was too broken down. Like I couldn't go to a normal doctor and get told to buzz off again. But he sent me to Dr. Armitano in Seattle, who is a neurologist that only works with POTS and EDS patients. And then very quickly thereafter, I met Dr. Erickson from Erickson Hand and Nerve Center, who specializes in upper extremity surgeries for EDS patients. And they confirmed my, original family medicine doctor's diagnosis. So
Dr. Erickson is the one that let you film some of your
yes.
content on TikTok and stuff. Yeah, that's nice.
Yeah, it was so cool. He came in that morning for surgery from the pre-op. I'd only met him twice, met him once for our initial consult, once for a pre-op, and then we're having surgery a week later. And he comes into the operating room and he goes, "Hey, do you want to film a TikTok real quick?" And I'm like, "Sure," hand the phone to my wife. He runs through it, bends, breaks my ankle, and
Wait, that was his idea?
That was it was all his idea. Yeah.
I didn't know that. I love
It was all
that.
That's the first video I saw of you.
Yeah, that was all his idea. And
that's awesome.
And it was exactly 3 minutes and 10 seconds long. And I had just gotten enough followers I could post 3-minute videos. I think that was a limit at some point.
Yeah. And
yeah.
That's really cool.
Yeah, that's awesome.
So I woke up the next morning and my phone had blown up from TikTok, and I had I had my first anesthesia reaction meltdown moment.
So it wasn't a meltdown like we experience an autistic meltdown specifically. You had an inner action, right?
Yeah, this is a different anesthesia related, and really, honestly, what it is, guys, is we got to be careful, especially for me, like a patient with PTSD. General anesthesia can really knock us away from baseline. So, if you've got any kind of trauma or kind of issue, a brain that works like mine, then that's something to be aware of. That you could come out on the fight or flight side of things, and I've learned twice now to put my phone away when that happens.
It's actually commonly known in the anesthesia world, peds, I know, that they are very prepared for a very violent interaction when an autistic child wakes up from anesthesia. So take that for what you will. I'm assuming us adults have similar bodies.
Well, I mean, I've got notes from a nurse named Mark from 2 weeks ago that he can attest that I woke up swearing and aggressively talking about my family. So
I woke up mid-surgery when I had my tonsils taken out, and I was bossing around the nurses because I thought they were doing things wrong.
Yeah, I know. At
Shelli?
Liv, at Liv on TikTok, she's made TikToks before about being aggressive after waking up from anesthesia too. So
I'm barfy.
I also, so I've woken up during surgery,
oh my goodness, ouch. That is,
and
I can't
I
imagine.
had my tonsil taken out and was trying to talk.
Oh,
So that just tells you how irrational someone might be, because
yeah.
So we respond to different medicines and anesthesias differently.
Yeah.
So again, these are things we only know anecdotally if we get the chance to talk, if we get the community or whatever. So
Yeah.
So thanks for sharing your story, because I know that was really difficult for you.
Oh, it's been hugely difficult, but I'm happy to be able to share my experiences, without getting too philosophical. I'm happy that it's me, and that I can go through it and share it and communicate it, and try to help somebody else. And so with that, if there's anything that I can say after those two, interactions where I woke up and with a rage response from anesthesia, and it really just wrecked my, kind of recovery, because then I was, kind of, you shake off all the painkillers and then you're just left with a wound, right? So I just had my ankle operated on, and he was shaving off parts of my Achilles tendon, and drilled holes in bones, and roto rooted around in there with a arthroscope. So I woke up mad. So I think that pain medicine especially needs to be considered. If you are a fast metabolizer, they need to know that, and you need to know that, so that you can advocate for yourself. Because even if you are like me, I'm a fast opiate metabolizer. And I think that is part of what I'm going to do in the future to help prevent myself from having that rage response, is making sure that pain management aspect is handled in a better way. Because I also didn't have any medication on the drive home from the surgery. So I drove from where in Seattle, where the surgery is, to where I live, in the back of a Subaru for 3.5 hours with no pain medication. So
That's wild.
That's when I started really getting happy on TikTok.
Don't always respond the ways we would like when we're in a bad place. And I would also, you mentioned PTSD. I do think most of us that went undiagnosed have some medicalized trauma. There's generational trauma, and with a high incidence of neurodivergence, and us being diagnosed with that, I think I call it traumatism. There's this particular brand of trauma associated with being late diagnosed autistic too. So I just want to validate what you said, and thank you for. If you don't know Kind of Spoony's content, Brian's content that he shared, he's been very, very vulnerable about like the difficult parts of, the surgery and, how you behaved in ways because of the medication that you didn't want to, and, that sort of thing.
Yeah.
So,
Yeah. That first surgery, I ended up hospitalized for 16 days in a forced hospitalization, and was misdiagnosed with bipolar disorder. They thought that I had bipolar disorder and was in a manic episode. So they put me, pumped me full of Haldol and put me on Depakote, and I had to participate in a contested court hearing to win my freedom. And yeah, so and then that had knock-on effects. I lost my job. I it's tough, but I think everybody's got to find their way.
And here we are on
But
the
yeah.
other side, and you're able to talk about it. And
Yeah.
so thank you. Doug, what about you? Do you experience any like debilitating comorbid conditions?
I wouldn't say debilitating, but you see me just sitting here clutching my hands constantly. I spend half the year fighting Raynaud's issues despite being on multiple medications, circulation improver deals. I feel like
upside down before the episode.
Yeah.
Yeah.
Having blood circulation issues.
Yeah, exactly. I just kind of in general feel like my spine and body is a slinky, and maintaining any sort of organization is requires a lot of effort. Walking in a straight line is, an exercise in co-contractions to keep myself aligned. One of my biggest issues, and I've only recently realized it, is I spent my whole, youth fighting POT symptoms and chronic dehydration and orthostasis. And, I thought it was normal to jump up off the couch and see colors and almost hit the floor. And
Yes.
Yeah.
Very much
I thought
that.
it was
Yeah.
normal if you pick something off the ground, you may not get back up.
Yeah, it says you just honk into your header.
Yeah.
There's a reason
Yeah.
my nickname is Captain Concussion.
There you go. And I can't tell you, it's a double-edged sword. This is part of why I call myself Kind of Spoony, is I was able to do the things that a Marine does and be very active. And, one of those things is hydrate. And I was pounding tons of water, and I really did do everything that you would do to fight, the early kind of onset, except I also did it with too much weight on my back and, in less than ideal conditions.
Yeah,
So,
Shelli and I can relate to pushing ourselves way too hard being athletes.
Yeah. And that's it. I mean, to maybe throw some perspective on the whole men's side of that is that, growing up as guys, you're taught from, the time you could walk that you should hurt, you should be falling, you should be
pain,
in the dirt,
no gain.
all that stuff. And yeah.
Ooh,
So
it's going to be a whole section in my book. Pain is weakness in the body.
How dare you even complain? Just go out there and keep going. And so to even get any sort of attention to symptoms that now I know are unique to me and others with the condition, and other boys don't have these issues.
It's a different type
It's
of cultural
complete
gaslighting.
dismissal. Yeah.
And check it out. Here's, for me, it was there was an extra layer of difficulty because my adoptive father, who's not my biological father, right? He was in the Marine Corps. He's a Marine Corps officer, so there's already a level of rigor.
Right.
And then my little brother also joined the Marine Corps after me. So all of his aches and pains and all my dad's aches and pains, I thought everybody was just, sucking it up, only to find out that,
You were sucking it up more.
yeah. And like I said, I'm writing I'm soft launch. I'm trying to write a book. I don't know. I'm writing a book in my head, and hopefully it'll end up on
I've
paper
had a book
in your hands.
I've keep adding chapters. It'll get out
Yes.
one day.
Yeah. But pain is weakness leaving the body.
Write anything down.
I had to grapple with that. That phrase, pain is weakness leaving the body, that had been strength for me, right? When I'm, like couldn't motivate myself anymore, well, hey, at least I'm getting something out of all this pain, right? So what does it mean for me that I've been diagnosed with a condition that's hallmarked by pain? Does that mean that like my body is weak? No, that's taking the metaphor too far. But you kind of get where I'm going with it. And what really what I've learned over this 2 years of surgeries and healing and therapy and stuff is I had to change the phrase for myself, and now I say, pain is weakness leaving the body, because pain comes before healing, and healing is how weakness leaves the body.
Say it again.
Yeah, pain is weakness leaving the body, because pain comes before healing, and healing is how weakness leaves the body.
Pain is
Strength comes from healing afterwards.
Yeah. I'm gonna sit with that a second.
I know. Okay. So, yeah.
Yeah.
Are we ready? Did everybody feel like that was?
Sorry, there, mic drop.
That was deep.
No, are we good on that? So a few of you have mentioned family members here and there, starting with you, Brandon. Do you have any other family members that are affected by connective tissue disorder, or can you see it now? And are they other men?
So the only family member that I have ever met has been my mother, and she was
Okay.
adopted, and I never knew my father. So all of my symptoms come from her. And
Okay.
something that was mentioned before was waking up during surgery. She had woken up from about 4 different surgeries.
Ooh.
And that was my motivation to get the diagnosis. Because initially I thought, what am I going to do if I know it? What good is it for me to know this or not know this? Until I thought, she's waking up during surgery. And I've been to the dentist, and I go through Novocaine like a professional. If stick me, I'm good in 20 minutes. It's frightening. So I know if I had to go under for surgery, I'm waking up. So I just wanted some medical reinforcement to know that, maybe they need to pay a little bit more attention.
No, you're totally right to do that. And having had 6 surgeries now, the anesthesiologists definitely pay attention whenever you say, I mean, for me, they come into the room now and go, I know that you have Ehlers-Danlos syndrome, so I've already prepared this, and this, because I go to the same surgery center and stuff. But, what you can do is there's on the Ehlers-Danlos Society's website, there is a good article about Ehlers-Danlos and anesthesia that you can bring with you to your provider. That's, a scientific paper. It's about 7 pages long, maybe, or maybe the anesthesia ones, it might even be shorter than that. It may only be 1 or 2 pages. And that can, for anybody out there that's listening, that can be a way of kind of helping yourself. And same thing with the dentist, because you mentioned the Novocaine thing. Me too. And I took the same article to my dentist and just said, hey, the next time we've got to do something major, I want to be knocked out because this is why.
Oh, the
Yeah,
dentist.
my historic experience with the dentist has been 4 or 5 shots, and then eventually my eyebrow is twitching and stuff. But I was recently numbed for the first time since diagnosis, and we had a whole chat about that. And he tried he said, let's try Articaine. I said, yeah, that's
Okay.
on my list of stuff that my research says is good. It is the first and only time that one shot was the perfect amount.
Awesome. I'll keep that in mind.
Articaine?
Articaine.
Articaine. Yeah, because I usually end up the same. Like, shot, can you feel it? Yes. Shot, can you feel it? Then you get the eyebrow. And then one
Yeah.
time I couldn't blink or move. And I was like, I'm done with you trying to do anything with me. Bye. That's
I got a lot of work done through a dental school, and something they did when they were working on my bottom teeth, it would not numb at all. So one of the instructors came over and said, pay attention because this is probably the only time you're going to see this, to my student dentist. Opened my mouth and gave me like the shot above like the ear inside my jaw, like it was angled very particularly. I think something about it was before the nerve deviates into like the branched paths of the teeth, and that one got me. They tried everything else, would not work, but that one got me.
I do not know that I would trust.
Temporomandibular nerve block or something.
Mm.
Yeah, interesting.
That's a lot of delicate, like a trigeminal nerve pathway there. You mess that up, boy, you're in for a lifetime of not fun.
Interesting.
I don't know, has anybody else got impingements along the cervical area?
Yes.
I think my entire cranium is impinged onto this thing.
I don't really
Do you guys
know
get
how
that?
it's attached. I'm pretty sure it's just attached by skin at this point.
So I get this one recurring, kind of neck ear nerve one that'll flare up where it feels like there's like a corkscrew going in from like my ear into like kind of like my nose almost like that. You guys have like facial pain?
I get just lots of twitching and spasming and like feeling like my head is going in a direction I don't want it to go to. I mean, you guys have seen me. I've been moving this entire time.
Oh yeah.
Anyway.
So my neck is kind of a mess. When I was 27, so back in 2002, I was diagnosed with a sort of rare brain tumor. It's in the base of my skull, the same location as the whole Chiari malformation.
Mm-hmm.
Oh,
The deal is called a foramen magnum meningioma. So meningioma, the type of tumor, foramen magnum, the base of your skull is kind of like a champagne cork that was down into the C1 vertebra and mushrooming out into the base of my skull. And so I'm currently missing a whole chunk of the left suboccipital part of my skull, and the whole back.
Wow.
And the whole posterior arch of C1 is gone, and the left half of C2 is gone. So there's some weird stuff going on. There's some weird stuff going on with that. But that was a 14-hour surgery.
Oh my goodness.
When I was 27, and I was married 2 years at the time. And at the conclusion of the surgery, they told my wife that we've loaded him up with all sorts of stuff. He probably won't be, awake until like tomorrow afternoon. And this was like at 8 p.m.
Okay.
And apparently, as they were taking me to recovery from the OR, I blew out the ventilator and started swearing at everybody present.
That track.
Okay.
Yeah. And I'm also a redhead, so weird upon weird.
You get the double whammies. Yeah.
My husband's a ginger.
Yeah. Me and my baby zebra are too. So I know exactly what you mean.
So, I already forgot what I was going to say. Wow. So anyway, yeah. Did you think you were going to get the whole thing today? We talked for a long time. More of this next week. And more of Megan next week too. I won't deprive you of that. Okay, bye for real. Evie, congrats on finishing 7th grade, babe. Love you.